With such long-standing beliefs and guidelines that don't reflect this optimal approach, it can be challenging to advocate for yourself and find the right provider. A lot of common medical beliefs, like the old fear about oral estrogen causing blood clots, or maybe the idea that statins are always the best first step for everyone, are sometimes based on older studies, or maybe studies that didn't differentiate between, say, synthetic progestins and bioidentical progesterone, or perhaps there's some confirmation bias. It's hard to change established ways of thinking, even with new evidence. It's about finding someone who stays current, who questions the status quo. Someone who's willing to look at robust data, like from randomized controlled trials, and ask, does this apply to my patient sitting in front of me? Look for a provider who emphasizes really comprehensive lab testing, maybe goes beyond just TSH for thyroid, for instance. Someone who discusses bioidentical options, if appropriate, and really talks about a treatment plan based on your symptoms and your goals. Ask them maybe how they weigh subjective well-being and how you feel against just the objective lab numbers. They should be willing to look beyond those potentially outdated guidelines and tailor therapy to you, understanding that normal isn't always optimal for you. The journey to optimal health isn't about just fitting neatly into some predefined range. It's about finding what truly allows your body to function at its best, to thrive. Which leads to maybe a final thought to consider. What normal aspect of your own health or your live results might actually be holding you back from truly thriving? Is normal really your goal? Something to think about. We really hope this deep dive empowers you to ask more questions, to dig a little deeper, and maybe seek out healthcare providers like Within You Therapeutics, who really understand the power of optimal.